Hey everyone, I'd like to thank you for tuning in and being here during this kind of scary time. I hope everyone is staying as calm and healthy as possible. We're excited to be here and we're excited you're here. So before our lives were turned upside down and when we were still planning on doing this talk in person, I had all of these grand ideas about opening the talk with some kind of an interactive activity. So something engaging. And one of the ideas I had was to put a dyslexia simulation up on the big screen. And of course, it would be this lengthy paragraph where the words were all jumbled and letters were even blinking on the screen. And I was going to make you all decode it within a time constraint. And to make it even more stressful, I wanted to play an audio recording that mimicked background noise in a classroom, maybe some feet shuffling or pencils tapping. And of course, the idea was to give everyone a flavor of what it might be like to live with dyslexia and to try and do schoolwork and homework with dyslexia. But at the end of all of my ideas, it just didn't feel right. In fact, it felt pretty impossible to simulate the feelings that individuals with dyslexia and anxiety have, the feelings that they grapple with on a daily basis, for those of us who might not be struggling with those conditions. So I went online and started doing a little digging about what other people might think about these simulation activities. And as it turns out, I'm not alone in my feelings. In fact, right there on the International Dyslexia Association website, I found an article written by an author with dyslexia who had pretty strong feelings that these dyslexia simulation activities aren't effective, that they don't really give us a taste of what it might be like to deal with such a diagnosis. And this author wrote about a simulation that came out in about 2016, so her article is also from that time. She said, and I quote, "Dyslexia is much more than experiencing frustration while struggling to read text. And this simulation offers about as much insight into the dyslexic experience as skipping a meal offers a well-nourished person insight into the experience of starvation." She also wrote, "The two are as different as a 100-yard run and a marathon. It would be absurd to say that someone who has run 100 yards knows what it's like to run a marathon. Claiming that the simulation imparts insight into what it's like to have dyslexia is equally as absurd." So, on that note, rather than starting with an interactive activity, I wanted to open up with the idea that unless you are someone who struggles with dyslexia and or anxiety, you can't possibly know what it's like to live with these on a daily basis. And that makes it all the more crucial for us to educate ourselves and to advocate when and where we can. So I wanted to start by going over some definitions for these three terms: dyslexia, anxiety, and stress. When I was preparing for this talk, I came across a wide variety of statistics on these topics. And what I learned is that the prevalence of these diagnoses that were shared by different resources and different websites varied based on the definition that they were using. And I found a lot of variability in the definitions for these terms. And so I think it's very important for us to use definitions that are based in research and that are from reliable and valid sources. So that first definition for dyslexia comes from Dr. Sally Shaywitz. She is a professor at Yale University, and she's the co-founder for the Yale Center for Dyslexia and Creativity. And her definition for dyslexia is actually several sentences long. I think it even spans a full paragraph. So this is an adapted version of her definition. But she says that dyslexia is a brain-based difficulty, so it's neurologically based, in reading in an individual who has the intelligence and reasoning skills to be a much better reader. And she goes on to point out that there's scientific research that shows differences in brain connectivity in dyslexic learners and typically reading students. The next definition there for anxiety comes from the American Psychological Association. They say that anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical symptoms. They also point out that many individuals who are struggling with anxiety engage in avoidance. So they avoid certain situations based on their worries and fears. And then finally, that definition for stress comes from the American Institute of Stress, and they say that it is a condition or feeling experienced when an individual perceives that the demands or the adversities exceed his or her personal and social resources. They also gave an alternate definition for stress. They say this is probably the most common, and it is a physical, mental, or emotional strain or tension. So based on those definitions, we can now go over statistics now that we're on the same page about what would define those terms. So we know that 20% of individuals have dyslexia. They have a brain-based difficulty in reading compared to other significant strengths in other areas. 30% of individuals are thought to have anxiety, and there are some sources that say that anxiety is the most common mental health issue among children and adolescents. The research also shows that about 20 to 30% of individuals with dyslexia also have anxiety, so they're struggling with comorbid diagnoses. A couple other interesting facts. More than 60% of children and adolescents with dyslexia also met the clinical criteria for at least one additional behavioral or emotional disorder. So this could be clinical depression or generalized anxiety disorder. Some children also struggle with oppositional defiant disorder. And 50% of children and adolescents with dyslexia also meet the criteria for an attentional disorder or ADHD. Okay, so here we have a normative curve. We're going to look at this curve as it pertains to the dyslexic population and their future functioning. Over there towards the left side of the curve, on the far end of the spectrum, we have the less than desirable circumstances. These are circumstances that no one would hope that children would end up in. Now, there is some research pointing out that many students with dyslexia end up dropping out of school. They struggle to find employment. And there also have been some studies done to show that prisons have a disproportionately high number of dyslexic or illiterate inmates. Okay, now all the way on the other end of the spectrum, we have the best case scenario. This is what we hope for our children, that these would be the dyslexic learners that end up successful, happy, confident, maybe even they have expertise in a specific niche or career. And just like on any normal curve, most dyslexic learners will fall somewhere in the middle, more in that gray area. So about 50% of dyslexic learners will fall under the tallest part of the curve. And, obviously this is kind of an oversimplified model for future functioning of dyslexic learners, but the purpose for going over it is so that we view dyslexia through a resilience framework. And what I mean by that is we are looking carefully at the risk factors and the protective factors in these children's lives that can really determine where on the spectrum of future functioning they fall. So risk factors are characteristics at the biological, psychological, familial, even community and cultural levels that precede and are associated with a higher likelihood of negative outcomes. Okay, on the other hand, protective factors are characteristics associated with a lower likelihood of negative outcomes, or they essentially reduce a risk factor's impact on one's functioning. Now, when the risk factors in a child's life far outweigh the protective factors, it is safe to assume that they're going to end up on the side of the curve that we don't want them to end up on. When the protective factors outweigh the risk factors, that is when there are more supports in place than there are risks, they end up on the side of the spectrum we would hope for them. And dyslexia, as well as anxiety, both can be considered potential risk factors. But there's a lot of good news in the fact that we can provide more protective factors, we can provide more supports and certain kinds of remediation that can help them fall on the side of the normative curve that we would hope. So first, I'm going to go through some of the risk factors, both internal risk factors and external risk factors, and then talk about some of the red flags to help us identify anxiety in these children. The risk factors I'm going to review, they're not an exhaustive list, but they're some of the major ones that I have noticed. So a major risk factor, first of all, is the severity of the learning disorder. A lot of parents ask me, is my child's dyslexia mild, is it moderate, or is it severe? We do not have a specific set of criteria that we can base that on. But what a lot of clinicians base it on, and what I base it on, is how much is the learning disorder negatively impacting the child's ability to perform at their potential or to feel emotionally happy or maybe even emotionally neutral. And when the learning disorders are moderate or even into the severe range, that's when we can say that it's a stronger risk factor than if it were just mild. On that same note, if there are other learning disorders present, if a child is struggling with dysgraphia, which is a learning disorder in written expression, or dyscalculia, which is a learning disorder with impairment in mathematics, the more learning disorder someone's struggling with, again, the higher of a risk factor they become. Emotional disorders, having genetic vulnerabilities to anxiety or depression, also can be risk factors. When children are uninformed about the learning disorders that they're struggling with, they tend to internalize and point blame inward. So they might think, oh, it's all my fault. I'm, a bad student. There's no point in studying. And then they become down on themselves and it becomes an emotional risk. Also, the research shows that there are not many preschoolers who have dyslexia who also have comorbid anxiety. And what the research is showing is that the anxiety develops in these dyslexic learners over time after facing repeated failures or putting forth effort and have things still not go well in school. They develop the anxiety. And they also develop a negativistic mindset. So they engage in a pattern of thinking that is not balanced at all, but instead it's negative and it's anxiety-ridden. So there's information out there about the kinds of mindsets that individuals with dyslexia have. And here are some examples of cognitive distortions that they might think. In general, individuals with language-based learning disorders feel that they lack efficacy or the ability to control their outcomes. So when they do well, when they're successful or they earn a strong grade, they tend to say that was based on luck or chance. That teacher happens to really like me, or they happen to make that test easy that time, or grade my answers easily. But when they fail or when they face adversity, they tend to think that the failure indicates their inadequacy as a person. So these thinking patterns basically attribute their successes to external sources that are outside of their control, while their failures are attributed to internal sources, that it's their fault. They also feel less than others. They feel inferior. They feel different. And because of that, the world seems unfair. There's a little bit of a hopelessness and helplessness that things could improve. If you notice that a child is engaging in these kinds of thinking patterns based on what they say or how they behave, cognitive behavioral therapy can be a great intervention to help these children change the patterns of their thinking. What a CPT therapist will do is help them identify and catch themselves when they are engaging in this negative kind of thinking. And then once they become masters at catching themselves, then the idea is that you want to arm them with tools so that they can replace the negative thoughts with more balanced thinking. So maybe they even learn how to challenge the negative thoughts and find evidence based on really what's happening and based on logic for why those thoughts might not be true. And then later down the road, the idea is that they can replace those thoughts with healthier ones. And we know that when we think in positive ways, we feel more positive. And when we feel more positive, we behave more positively. So cognitive behavioral therapy really teaches us about the strong link and connection between our thoughts, our feelings, and our behaviors. And again, it can be a wonderful tool for children who have dyslexia as a risk factor in their lives. Okay, here we have some external risk factors. A lack of access to remediation or appropriate educational setting is huge. There's lots of research that supports specific kinds of instruction, specific kinds of programs to help children overcome their learning disorders, their dyslexia. However, not everyone has access to them. And when we cannot provide the tools for a student to overcome the setbacks that are a result of the structure of their brains, they're going to continue to struggle. Even when a child has access to remediation or an educational setting that helps them overcome the dyslexia, guess what? The academic demands are constantly increasing. So even once you catch up to grade level, you start the next school year and it's, a higher demand. And so even when they're doing well, they have to keep fighting to do well, and that's a little bit of the uphill battle that is an example of a risk factor within dyslexia. The last few there are social, are socially based, and so when these children are compared to their siblings or peers who are more typical learners, it can be really defeating for them. If they're bullied or teased, certainly that's a risk factor. If there's additional stress at home within the family, if there's a family member who is sick, or if there's a tumultuous divorce, that's added on stress. And of course, the lack of friendships or supportive relationships is a huge risk factor for students with dyslexia. Having someone advocate for them, having someone understand the way that their brain works is really crucial. Okay, let's talk about stress. So the Center on the Developing Child at Harvard has identified 3 categories of stress. We have a positive stress response, a tolerable stress response, and a toxic stress response. So these terms refer to the effects that the stressful experience has on the body and not to the stressful event itself. So a positive stress response is normal. It's an essential part of healthy development. It's inevitable. We cannot avoid stress. Positive stress response is characterized by a brief increase in heart rate and maybe mildly elevated levels of hormones. In these cases, the child can be easily brought back down to baseline by the presence of a supportive caregiver. So, for example, maybe starting a new school year with new classmates and a new teacher could be stress-inducing for a child. The fact that they have a parent that's consistent in their lives that say, you can get through this and I'll be there at 3:30 p.m. when school's over to hear all about your day. We'll talk about anything that came up that might have been hard. Another example is getting a shot at the doctor's office. So having a parent sit there and hold their hand for them to get through helps decrease the body's reaction to those mildly stressful events. Tolerable stress response activates the body's alert system to a greater degree. And that's because the stressful event might be a little more severe, a little longer lasting. Now, if the activation of the body's stress response is time limited. And again, if it's buffered by a consistent, stable, loving relationship with an adult caregiver, that can help the child adapt, and that prevents the stress response from being detrimental or having long-term effects on the body and the future well-being. A toxic stress response, on the other hand, occurs when a child experiences strong, frequent, or prolonged exposures to adversity in the absence of an adult support. So this kind of prolonged activation of the stress response systems can disrupt the development of the brain. It can impact cognitive development. It can impact the future physical health of the individual. So while it's safe to say that the presence of dyslexia can absolutely cause stress and anxiety, there's something really hopeful in knowing that we can minimize the extent to which the stressors have a negative impact on the child's life. And we can do that by simply being present and being with the child as they endure the adversity and the hardships, and assuring them that they're going to be okay at the end of it. Okay, so how do we identify anxiety in children? How do we know when it's not just positive or tolerable stress response, but that it's more so clinical anxiety? First of all, we just want to be aware that anxiety is statistically probable in children who have dyslexia. It's also more probable in children who have ADHD. So because comorbidities are so prevalent, you might want to keep an eye on those kids who you know are genetically vulnerable to having the anxiety. Worry has to be persistent and excessive to meet criteria for clinical anxiety diagnosis. So a good way to think about that is that the worry has to occur more times than not for at least 6 months. And usually the worry is out of proportion to the situation. A lot of times anxiety in children can present as irritability, moodiness. They might lash out, which might be out of character. There's also physical symptoms, so crying, headaches, stomach aches. Young children don't have the verbiage to say, I don't want to go to school today. I'm really anxious about performing well on my math test. But instead, they're going to wake up and they're going to say, my tummy hurts. I don't want to go to school. And they might cry. So a couple other red flags in identifying anxiety is when the child is really inconsolable or unable to be comforted by logic. They might require repetitive reassurance because they're asking themselves all of these what if questions. What if this goes wrong? Or what if this person does this mean thing to me? And they tend to answer these what if questions with that negativistic way of thinking. So they're thinking about worst case scenarios. They're thinking about what could go wrong rather than what could go right. They don't really have the skills to challenge themselves and think, well, what if this person says something really nice to me? Or what if I do really well on this test or in this scary situation? They might require extra coaxing to do normal activities or activities that used to bring them joy. You might notice that they're worrying hours, days, or weeks ahead of certain anxiety-provoking events. You might notice that they're excessively concerned that others are upset with him or her, or that people are going to be upset with them. So they might unnecessarily apologize or check in to ask if they're doing well or if they got the answer right. And they also aren't really comforted by logic. So it's fear-based, right? It's not really based on what's actually happening. It's not real. So if you're noticing some of these red flags in a child, again, cognitive behavioral therapy can be a wonderful intervention, or maybe even just touching base about how they're feeling, making it a point to check in that their emotional sides matter just as much as their academic ones. So here we are at the protective factors. So these are the things that we can do, so that parents, educators, psychologists, tutors can do to help minimize the risk for these children of having dyslexia, and minimize the risk that the dyslexia will also cause subsequent anxiety. Okay, so the first thing is to define the dyslexia, define the anxiety, and to educate ourselves and to educate our children. And the first way to do that is to seek a formal, comprehensive psychological evaluation. Not all evaluations are created equally, so you want to make sure you are careful in choosing the professional to assess your child. And having your child tested can be a process. I know a lot of different professionals do it differently, but most commonly you work with the child, or at least in my case, I work with the child for 6 hours total. And depending on their age, I'll break that up into smaller sessions, so they're not required to work or sustain their focus for too long. And then after that, I sit down with the parents for a debriefing that can be, up to 1.5 to 2 hours long, to go over all the results. And then I type all the test results up into a lengthy report that is meant to be shared with the child's school, with the educators, with the tutors, with whom the child is working on a regular basis. And a lot of times families will ask me, should I share these results with the school? Should I share the results with the teacher? And they seem concerned about the stigma that might be involved in the label of having a learning disorder. But the answer is absolutely yes. You should share the test results with the individuals, the professionals who are working with your child. You've gone to all this trouble and used these resources and spent this time in learning a wealth of information about your child's learning profile, what her strengths are, what her challenges are, what might be holding her back, the ways in which she needs to hear information that will help her process them efficiently, and retain them, and then to recall that same information, to use it as needed or to recall it for a test. And so you've learned all this information, so it's only as helpful as much as it is shared. And I'd like to think that teachers and educators will use that to help your child rather than harm them, that they'll use it as a tool. And I've seen it happen, that they can kind of tailor their teaching or provide certain kinds of accommodations that make learning more accessible for the child. And in the same vein, I am asked whether the results should be shared with the child herself. And again, my answer is most always absolutely yes. Of course, the age of the child is an important factor. So this information needs to be delivered in an age-appropriate and developmentally appropriate way, which is totally possible. So for younger children, what I might recommend is for parents to read a book geared towards that age group, 5, 6, 7-year-olds. And there are a lot of great books out there that are about that same age kind of character who's a young child who has trouble with spelling and trouble with reading, maybe even difficulty learning the alphabet. And the parents can read that book to the child, and then let the child ask questions as she sees fit. And so you kind of follow the child's lead and don't overburden with information, but that when they ask, you tell them kind of in an age-appropriate way. Everyone's different. We all have strengths. We all have challenges. Your challenge might be learning the alphabet or spelling words correctly, but we know how to help. And that's when you can get them on board with a tutor or whatever your game plan is, a specialized school placement that is going to help them overcome the challenge. For older children, maybe there are some families, some parents and children that can just have this open, frank, straightforward conversation. You can be concise, and you can use the word dyslexia, and you can tell them, what it means, and that there are also some positive characteristics and traits that can come along with it. Maybe for that in-between age group, not too young, they're not yet in high school, you can maybe tell them what a lot of their strengths are that you've noticed. And they can be strengths that come up in testing, in their learning profile, but also they can be strengths that you've noticed just in your daily lives. Maybe they're a really flexible thinker, or maybe they're really patient and kind with their friends. And you kind of build them up and you say, you have all these wonderful traits, and I've noticed this and this and this about you. And the testing told us that you're really good in math, for an example. And then you say, and everyone has areas where they could improve. And for you, that happens to be reading and spelling, okay, or whatever their main challenge is. And again, that's when you get them on board with the game plan you're putting in place. That's when you get them on board with the protective factors that you're putting in place to minimize the negative impact of the learning disorder, and thereby minimizing the negative impact of any possible subsequent anxiety. So along with this topic is to just learn about dyslexia, make sure you have the accurate definitions and that you are accessing the reliable and valid resources to learn about the diagnosis. There are some interventions, some remediation interventions that are proven to help, proven to be successful, and there are some that are not. And so just make sure you know the difference. For those of you who might be interested in accessing books that are meant for children with dyslexia to learn about dyslexia, the Yale website has a wonderful list of suggested readings. Okay, so what we're talking about here is multisensory instruction to help the child overcome the dyslexia. So we're talking about the kind of instruction that can change the neural pathways of the brain and give these children the tools to overcome the dyslexia. And we're also talking about accommodations, kind of like the Band-Aids. They're things that we can do in the environment to remove barriers to learning. And so the way to really remediate and remove barriers is a combination of multisensory instruction. This is research-based instruction, and accommodations. So remediation can come in a few different forms. You can have full immersion, which would be a placement in a specialized school meant for students with language-based learning disorders. A lot of times, all of the faculty and staff in these schools have been trained in these multisensory methods, and all of the subjects are taught as they would be in a full curriculum, but through multisensory instruction. So the curriculum is taught in a way that really reaches children with learning disabilities. This would be considered the most intensive form of remediation. Then we go down to an intensive tutoring program. This may look like 6 weeks or 8 weeks or 12 weeks, depending on your child's need. And the tutoring company may recommend the 12-week program where the child comes in for tutoring for 4 hours a day for those 12 weeks for weekdays. And then the next step down would be one-on-one private tutoring, still using a multisensory approach, but maybe in the afternoons after school or somehow incorporated into the school day. Tutoring sessions can be weekly or bi-weekly. I have worked with some families who did put their child into a full immersion specialized school and were considered remediated, and then they transitioned into the mainstream school environment and eventually came across a class or a certain subject that was very challenging. And so maybe they resumed weekly tutoring to help them get over that speed bump or to remind them of certain strategies that they found helpful. So remediation also needs to challenge in the areas of strength while supporting in the areas of struggle. So really this is talking about an individualized education plan. A lot of individuals with dyslexia are known to have really sharp reasoning skills. They're known to be intelligent and they have this ability to see the big picture. And so we want to make sure that we are pushing them in the areas where we can push them to be their best selves, to perform at their potential, while also bolstering in areas where they may need a little help. And if the particular school or program where your child attends is unable to provide that kind of individualized education plan, then you might be able to seek ways to challenge your child in the areas where they can be challenged outside of school. So there are weekend programs for learning or certain kinds of summer camps, certain kinds of ways to have them really hone in into robotics, for an example, or STEM activities, or maybe theater or music or dancing. So you want to make sure and be mindful that remediation doesn't lose sight of really what they're talented in and what they're passionate about. Also, we want to increase the level of task complexity at an appropriate rate. That's probably needless to say, but it is important, and it's the idea that the remediation and the tutoring moves along at a pace that works well for the child. A child who has dyslexia, who has really weak processing speed, may need to move along at a slower pace in tutoring. They may need to really master a certain concept in tutoring before moving on to the next, really master the foundational steps before building on that foundation so that it's really strong. Also, to be wary of lengthy breaks from school. So it's pretty common for a dyslexic learner to regress if there's been a long break from tutoring or a long break from school, because remembering those strategies and really holding on to the information that they've been taught sometimes can be a challenge. And that doesn't mean you have to spend your whole summers studying and foregoing vacations, but you do want to make sure and have a couple booster sessions when you can, or maybe even every other week, just so that they can maintain what they've already done during the school year. Okay, so here's a slide just on accommodations. This is another way to remove barriers. You're providing environmental supports. These are not cheating, okay? They are leveling the playing field. So really what accommodations do is that they make the expectations in the classroom fair and reasonable. It means that what we're asking of a dyslexic learner is something that they actually can do, that they can level up and perform what we're asking of them. And a lot of times they need accommodations to do that. So these are things like access to audiobooks, so that they can truly get lost in a story and really get to know the characters and the plot and the storylines without being burdened by the actual act of decoding or making inferences or reading between the lines, so to speak. Permission to use laptop computers is a really helpful accommodation for students with dyslexia. Writing can be really difficult because it's multifaceted. You have to think about how you hold the pencil. You have to think about how you form letters, how you indent for a paragraph, the spelling, the writing mechanics, the sequence, that there's a beginning, a middle, and an end, that the writing sample flows from start to finish, that it's organized. There are a lot of things to think about. And taking the burden off some of those things can really help a dyslexic student get what's in here out onto their paper. Permission to use spell check, not penalizing for misspelled words, maybe as long as they're legible or decipherable. Extended time is a common accommodation, giving them time to actually think about the strategies they've been taught and then time to implement them and use them properly. Ultimately, accommodations are only helpful if the students choose to use them. And it's quite frequent that a dyslexic learner says, no, I don't want to go in a separate room for testing. I don't want extended time, because they already feel different enough, right? They already feel like they stand out and all they want to do is fit in. And so they will choose not to use the accommodations. If you know a child where that's the case, I would encourage you to sit down with them and really just have this open conversation where you explain that they simply have different needs. And maybe weigh the pros and cons with them of using certain accommodations versus not using them. Maybe there's one that's really crucial for a certain student. The option is they can feel like a smart kid who uses a laptop, for an example, who might be a little different because they have to use a laptop, or they can feel like an inept learner who can't get what's in here out, but they're not using a laptop, so they don't stand out. So really kind of making sense of what they are foregoing versus what they have to gain, I think could be helpful, especially for our older students. Okay, another protective factor is to really empower these students. We want to involve them in their learning. We want them to understand what their strengths are in any given situation or any given class, what resources are at their disposal, how can they access those resources, who do they need to ask, how do they need to ask. We want to give them the tools to become their own advocates once they're old enough. We want them to know what their islands of competence are. We all have our islands of competence, and so we want to make opportunities for these children to understand what theirs are so that they can monopolize on them and show them to the world. I think a big part of empowering them too is teaching them that mistakes are inevitable, and they're opportunities to evolve and to grow, and to have them kind of look at their own errors and their own mistakes through the lens of, okay, so that happened, so how can I prevent it from happening again, or what can I learn from that hurdle? And by kind of owning our own mistakes and setting that model for them, we can really show them that kind of growth mindset, which I'm going to go over that in a couple slides. So something else we can do to encourage self-advocacy is to teach them to set goals. And of course, depending on the age of the child, this may be easier or may be more difficult, but you want to kind of teach them to think, okay, what is the first step that I need to take right now to complete this project or to begin studying for this test? And then from that first baby step, once they attain that goal, you say, okay, so what's the very next thing you have to do? So you're providing this external scaffolding for them to learn how to set up timelines and for them to learn how to set up goals. And the idea is that once they can establish these kind of baby steps, then they can set short-term goals or immediate goals. And eventually they learn that these immediate and short-term goals is what allows them to be on the path to achieve their long-term goals. Maybe the long-term goal is getting through 5th grade. Maybe it's graduating from high school and getting into a specific college, or down the road, maybe even becoming a chef. And so with each long-term goal, there are things that they could be doing right now to kind of show them that there is a light at the end of the tunnel, that this is worth fighting for and working towards. So over on the right side of the slide, there is a cartoon of the biblical story of David and Goliath. And just to refresh your memory, Goliath, this was back in 11th century BC, Goliath was a soldier fighting for the Philistines. And then David was a shepherd boy who was an Israelite. He was not a soldier for the Israelite army, but when Goliath stepped forward to represent the Philistines and said, I'm the strongest soldier here, and I challenge the strongest soldier on the Israelites to fight. And of course, the winner of their fight would win the whole battle. But no one from the Israelites stepped forward except David. And they let him fight because no one else offered to fight, but no one believed that he would win. And it turns out that he did win. So right when the battle between David and Goliath started, he had a smooth pebble and a slingshot, and he shot Goliath right between the eyes. And ultimately, Goliath died and David won the battle. And Malcolm Gladwell, the reason I'm bringing this story up is because Malcolm Gladwell, the renowned author, dedicated a whole chapter in his new book called Talking with Strangers to dyslexia. And he challenges us to really change our perspective of the underdog. Of course, David in this situation is considered the underdog. And a lot of us might think that individuals with dyslexia would also be considered the underdogs. But what Gladwell posits is that David won the battle because in the absence of being physically strong and physically tall, he had to figure out a way and use his creativity and his wit and his determination to figure out a way to protect his flock of sheep. And the way he did that was becoming a really strong slingshot user. And he was able to ward off bears and wolves and all these scary animals that threatened his sheep. And so what Gladwell says is when there's dyslexia, you can look at it like it's an underdog situation and they're at a disadvantage, or you could look at it like they're at a huge advantage because in the absence of being really fluent readers or really great spellers, they are forced to develop these other skills and really fine-tune them and spend time developing them that will serve them well. And an example here is maybe a second grader who has dyslexia and she realizes she cannot do her language arts homework. It feels impossible. It feels frustrating. And so she develops these really wonderful communication skills. She becomes a master negotiator where she talks her best friend into doing her homework for her. A win-win situation, right? And so maybe the second grader gets really good at communicating and negotiating and motivating others. And she may become a world famous entrepreneur. But had she been really great at her language arts homework, perhaps she would not have developed that skill set. So it's kind of an exciting, positive way to view dyslexic learners in that way, that there are advantages to the diagnosis. And in fact, I think when we interact with dyslexic learners through that perspective, through that kind of positive mindset, it makes dyslexia less of a risk factor for them. Maybe even it could make dyslexia a protective factor in a way that they have these beautiful strengths that they can use to become who they want to become. Okay, growth mindset. I mentioned this earlier. This term was coined by Dr. Carol Dweck. She's a psychologist, and basically, about 30 years ago, Dr. Dweck and her colleagues noticed that there are some students who became completely devastated when they faced adversity or when they met failure. But they noticed there were other students who rebounded really quickly when they faced failure. And from their work, they coined the terms growth mindset and fixed mindset. So a growth mindset is when students believe that it is possible to get smarter. They understand that effort makes them stronger and smarter, and so they put in the extra time and effort. And guess what? That leads to higher achievement. In a fixed mindset, there are students who believe that their intelligence and their abilities are unchangeable. So in other words, you have a certain amount of intelligence or a certain amount of skills, and you can't do much to change that. So Dr. Dweck, and I think a lot of us would agree that a growth mindset is crucial for a dyslexic learner. I think it's crucial for children in general, but especially when you have that added risk factor of having dyslexia, it's all the more important. And there are a couple ways we can help our children with dyslexia have more of a growth mindset. So one thing is to incorporate the word yet into our vocabulary. There's a big difference between saying, oh, I'm not much of a dancer, or saying, I'm not a dancer yet, because that indicates that you have the power to become a dancer. And the truth is that through work and through blood, sweat, and tears, a lot of us can reach pretty far. So we also want to model a growth mindset. How we talk out loud about ourselves and our own failures can have an impact on the child. I have a feeling that they're all listening and much more aware than we might give them credit for. Also, to help students engage deeply with their error rather than running from it. Kind of help them get to the bottom of what caused the error and maybe how to prevent that same error from happening in the future. And to praise wisely. So instead of praising things that we cannot control, things that are unchangeable, like maybe your intellect or your innate skill set, we want to praise things that are within the child's control, things like how much effort they're putting forth, what kind of strategies are they using to problem solve, and when their strategies aren't working, do they have the wherewithal to come up with another strategy and give that a try? Are they persistent? Are they focused? Do they have a positive attitude? These are the things we want to be praising our learners for. And also we want to focus on the whole child. Everything from physical activity to sleep to non-academic activities are hugely important. We want our dyslexic learners to know, to feel like they are well-rounded and to know that they have more to offer than just certain grade point averages. So physical activity helps us learn more efficiently. It can impact our cognitive skills, our academic behavior, our ability to focus, our behavior in the classroom or even outside of school. And the National Association for Sport and Physical Education recommends that children and adolescents are getting about 60 minutes a day of physical activity. Sleep, hugely important for both children and adults. So between ages 3 and 5, it's recommended that they get 10 to 13 hours of sleep per day. For ages 6 to 12, it would be 9 to 12 hours of sleep. And for teenagers between 13 and 18 years of age, it's recommended that they get about 8 to 10 hours of sleep. There's a really great TED Talk out there by Dean Bragonier. He's an advocate and an educator. He's someone who has dyslexia. And I loved what he said in his talk. He said, let's introduce these students to the cognitive skill set that they have that is directly a result of the construction of their brains. So let's teach them in a way where it innately makes sense, and let's assess them in a way that really lets them show what they know. Another way to focus on the whole child is to become very familiar with their interests and their passions. And there is a list on this slide from the book, The Dyslexic Advantage by Brock and Furnett-Eide. They're both neurologists. And towards the end of their book, on page 207, they list, it's an entire paragraph of interests and passions that they've noticed in their dyslexic clients. And there's a wide variety. You might feel like, well, I'm not sure really what my child's interested in or what they might be good at, but maybe it's going to require thinking outside the box. Maybe storytelling is their passion, the thing that they want to do. And you might just think like that they're talkative, but maybe start to give them space for the things that they really talk about a lot. Maybe it's fashion. Maybe it's coloring or crafting. So I encourage you to pay attention to what makes them tick, what makes them smile ear to ear. Okay, also paying attention to the child's underlying emotions is going to be a huge protective factor for them. A lot of times on the surface, a child can appear angry or they can appear short or even sassy. And most often when that happens, there's a lot more going on under the surface. And they may be at an age where they're not even aware of that. But as adults and caregivers and professionals, we can be aware of that and we can interact with them accordingly. So we want to help the child identify their emotions. We want to explicitly teach them coping skills. And coping skills are so individualistic. For one individual, it might be progressive muscle relaxation. For someone else, maybe journaling. For someone else, going on nature walks. And so really kind of teaching them what different coping skills could be, and then facilitating opportunities for them to figure out which ones work the best for them. And then we want to reward them for appropriately implementing those coping strategies. I think just being aware that when we see anger or we see opposition on the surface, that there's some more vulnerable emotions on the inside is a huge protective factor. Paying attention to a child's emotions and making space for them is sending this crucial message, which is how you feel is just as important as how you perform. And I think that all children could benefit from hearing that, but especially our dyslexic learners. Okay, so the point of providing more protective factors than there are risk factors is to help our children get into a cycle of success, as opposed to a cycle of failure where they are engaging in a negative pattern of thinking and having emotional issues as a result. So competence is the best way to eradicate stress and anxiety. Competence can come from a remediation program, appropriate educational setting, competence maybe even in a non-academic area through an interest or a passion or a hobby. And when we build competence in these children, we build confidence. And guess what? Confidence begets more confidence. So through these protective factors, your child can get into a cycle of success. And Dr. Kandel, who won a Nobel Prize for discovering the central role synapses playing in memory and learning, he said that behaviors and thoughts that relate to hope, love, and happiness can also change the brain, just as fear, stress, and anxiety can change it. It's completely symmetrical. I wanted to share with you the distress model that was developed by neurologist Jerome Schultz, and it's a nice acronym. So he talks about a lot of the same protective factors and game plan that I've talked about here, but I've included a link where you can hear him speak a little bit about each one of the factors in his distress model. And I also want to mention, again, the book, The Dyslexic Advantage by Drs. Brock and Frenette-Eide. Towards the end of their book, they kind of summarize a lot of the internal supports and external supports that they're advocating for. And again, there's a lot of overlap with what I've already talked about here. But the internal supports is that they develop confidence, self-worth, that they learn of themselves as being important outside of school, but also that they have confidence in school, that there's a positive attitude and optimism about the future. So that ties into what I was saying about baby steps leading to short-term goals and short-term goals leading to long-term goals and helping them understand how all of those connect. Metacognition is thinking about thinking. So we want our dyslexic learners to understand that when they come across a problem or a dilemma, a learning hurdle, that we want them to pause and think, okay, this is the problem. Where in my, imaginary toolbox can I pull a strategy or a tool to help me overcome it? And maybe for that situation, it's calling your tutor or it's asking your parents or your teachers for help. But the idea is that they become thinkers about how they think. That's how they can self-advocate for themselves. Doctors Eide also talk about external supports. So I think I've mentioned a lot now that parents and teachers and caregivers play a crucial role here in supporting children with dyslexia. Also that they're in an appropriate educational setting, that they're being remediated in their areas of weakness, and they're balanced by engaging work in their areas of strength. And again, having a formal, comprehensive, well-done psychological evaluation can really help you hone in on what are the specific areas of weakness and what are the areas where they're already excelling, that they can be pushed and challenged. And also we want to notice a child's stress level and respond with great care and attention. So this goes back to the 3 different stress levels We want to make sure that we are present, that our care is consistent, that we are predictable for our children, that we notice when they're stressed and we kind of intervene, but intervene in a way that still helps them feel in control and that we're more so guiding. And that's how we can prevent their stress response in their bodies from getting to a toxic level. Okay, that concludes my presentation. I want to thank you again for being here, and I hope you all take care.